Fy marn i ar y system y trwyddedu ydy, mae o'n syniad da i helpu bobl fatha fi sydd wedi hyfforddiad i arbenigo yn y maes ac yn sicr yn help i gadw safonau i fyny.
Fysa neb isio i bobl sydd heb gael hyfforddiant penodol i fedru ymarfer, achos os o ddim, mae rhaid bod pobl yn gwybod bod nhw yn gallu ymarfer yn ddiogel ac yn effeithiol.
This national licensing system would protect the public from anybody setting themselves up as an acupuncturist without being a member of a professional body.
Despite popular beliefs, it is a professional business. We do take pride in it, a lot of it. There are people out there who just don't care and will tattoo anyone and everything for money. I think it does need to be regulated more.
I think what is apparent is quite often the theory of licensing or regulations put out there without really truly understanding the landscape that exists in terms of the providers of these treatments. And ultimately, I think what often is missed off, although it's under the guise of providing a better environment and platform for consumers and the public to be safe, I think quite often the public are the last people to be considered in terms of how effective a licensing scheme could be.
As in effect to the business, I think it'll just make us all more professional, which we aim to be anyway. It shouldn't do us any harm.
Mae yna systemau, wrth gwrs, yn barod. Da ni fel acwybwyr sy'n aelodau o'r British Acupuncture Council yn gorfod dilyn rheolau llym iawn, cyn bod ni'n cael gosod i fyny mewn practis yn y lle cyntaf. A da ni hefyd ar hyn o bryd yn gorfod cofrestru efo awdurdodau lleol. So mae yna systemau mewn lle yn barod, a dwi ddim yn siŵr be ydy oblygiadau system newydd, a fydde'r system newydd yn gwneud yn lle y system sirol, neu fysa fo'n lefel eto o fiwrocratiaeth.
If it's done well, it won't affect it at all because I'm very good at what I do. But it will increase costs on an already stretched industry if it's done badly. So the important thing is to streamline the inspection and to do it knowledgeably, and that will make it fairly cost effective. It's got to be delivered at a low cost, and it's maybe finding of unlicensed operators might help fund some of it. A system of more regular checks should be put in place for those operating at below standards, and less frequent ones perhaps for higher studios, and again this would provide a more cost effective service. You can do this and do it well.
I think having a compulsory licence scheme, if everybody was on that scheme and everybody was accountable, it'd be effective. I think my concern is that actually the people who are currently providing good service will buy a licence and continue to give good service. And the people where you've got the majority of your issues, guess what? They won't buy a licence. They'll continue to provide bad service, and the consumer will continue to be at risk.
I don't think that creating a compulsory licensing system would improve the standards of anybody who is already a member of a professional body. But I do think it's important just to catch anybody who isn't a member of a professional body.
Mae gynnon ni system lle mae gynnon ni I gyd yswirion llawn er enghraifft indemniad proffesiynol a atebolrwydd cyhoeddus. Wedyn mae pobl sy'n dod I gael acubigo gan bobl sy'n aelodau o Gymdeithas Brydeinig yn gwybod bod nhw'n mynd I fod yn saff.
You need that consistent, you need to all be singing from the same hymn sheet straight away, and then with that level playing field, then we can only raise standards further. A lot of us, we pay a lot of attention to what we do, to every single part of it. I changed my whole range of inks because of one client, the one that has the intolerance to witch hazel.
We could look at rating systems for tattoo studios. There's an introduction of that, and there's been a look at that across Northern Ireland in Scotland. They're looking at it. But I have talked to artists in this area, and they say that it's been done badly. And again, the inspections are done without knowledge, and it's not increased standards, and it's not stopped illegal tattooing, which is one of the main points here.
Licensing affecting standards of electrologists and electrolysis should always start within actually the training, within actually all the colleges in the area. If that can be established, then myself as an employer would actually have a very much better level of confidence in having the right actually kind of obviously people coming to me to work actually on the public.
It could gradually increase standards, especially if we put in some sort of apprentice scheme system and an apprentice licensing system. It could gradually increase standards over the years.
O ran y mathau o driniaethau, dwi yn teimlo nad ydy bobl ddim yn deall sut mae electrolysis, be ydy'r cama, sut mae'r driniaeth yn gweithio. Felly dyda ni ddim yn pirsio, dydy o ddim yn mynd i fewn i'r croen, i'r follicl, sydd yn ddau beth hollol wahanol. Hefo yr tatwyo a'r acubigo, mae hynny yn mynd i fewn i'r croen, ond i'r follicl yda ni'n mynd i fewn iddo fo. O ran trefniaethau, swn i'n licio fysa'n cael ei adio at fo, yn sicr ydy Botox a laser. Ar y funud, mae yna gymaint o gliniga a pobl yn gallu prynu'r peirianna yma ac ella sydd sicr ddim i fyny i safona.
Mae gen i fel acubigydd farn sydd yn falle yn awgrymu dwi ddim yn siŵr pam bod acubigo fel da ni'n ymarfer o yn rhan o'r special procedures o gwbl, achos mae'r peth eraill da chi wedi restru, sef tatwyo a tyllu clistiau a electrolysis. Maen nhw'n math wahanol iawn o driniaethau, dwi'n credu. Mae'r hynna'n fwy o driniaethau harddwch os liciwch chi, yn hytrach na triniaeth iechyd. Mae acubigo fel mae acubigo traddodiadol yn cael ei ymarfer yn broses trin iechyd fan amlwg.
I think laser tattoo removal should be removed from the remit of the HIW, as it's proving to be anti-competitive with laser operators in England. It provides a lack of service to Welsh needs, and it's driving Welsh consumers to try dangerous removal practices at home, and it's just not a good thing. Laser removal is expensive and difficult to come by in Wales, and that's due to the expensive licensing system that's been developed by HIW. So we need to really address that. But also, as far as other procedures are concerned, you need to look at branding, scarification and extreme body modification, which you might not even be aware of. There's a lot going on. It can be done well if it's done properly, but there's probably only a few operators maybe in the UK that do it well, and everybody else it's pretty dangerous. So you need to look at branding, scarification and extreme body modifications, and by that I mean things like, when I say dermal implants, I don't mean the dual dermal implants, I mean things like horns, stars, also modification of body parts like tongue splitting, penis splitting, various other things. So branding, of course, is self-explanatory, and scarification is where they remove a section of the skin and it scars up, and it's becoming more popular now, and that really needs to be looked at.
Special procedures should incorporate scarification in all its forms, whether that's done, people are doing it with scalpels, people are doing it with tattoo machines with no ink in it, and just gouging in scars. As I said, I was an army medic, and colloiding the skin is not a nice thing. Branding, they're using blowtorches and bent coat hangers, adapted soldering irons. Inserting foreign objects into your body is not a good thing without some sort of legislative weight behind it to say that's unsafe, or is the material safe, or has it been checked? Is it sterile? Have you autoclaved it before you put it in there? Where did you get it from? Has this come out of a 5-penny ball machine round the corner? None of these things are answered. So whereas we have with our ink, we know where it comes from, the batch where it's from, it's bought by my needles, I know where I bought them from, when I bought them, and the expiry dates. These things, that it's part of our pro forma. It should be the same with branding, scarification, and inserts.
Dwi wedi bod mewn busnes ers 16 mlynedd ac yn yr 16 mlynedd unwaith yn unig mae yna rhywun wedi dod rownd i gael gweld os ydw i yn cael gwarad o'r pinna'n saff, o be dwi'n ddefnyddio i llnau y croen. Os dwi'n cadw record card a dwi'n cadw record o pawb, mae pawb gorau llenwi consultation sheets ac yn arwyddo fo. Dwi'n gorau mynd yn reit fanwl i'r, os dyn nhw ar ryw fath o feddyginiaeth. Yn sicr dwi'n gwybod rwan am rei llefydd sydd ddim yn gwneud hynny. Wedyn mae hynny'n anodd i rywun da fi sy'n cadw i fyny i'r safonau eraill a llefydd eraill ddim. Ymreder i wedyn ydy os fysa hyn yn cael i bod yn mynd yn drwydded, os fysa yna rhywun dod yma i weld y peiriant ac i gael gweld beth dwi'n neud ar ddiwedd y dydd, dydyn nhw ddim efo dim syniad, dim clem os ydw i'n cario y driniaeth allan yn iawn ac yn neud o'n iawn.
The inspections need to be streamlined, they need to be to the point and accurate and relevant within the industry. It could reduce costs, not increase it, but they do need some training. Most of the inspectors, no fault of their own, have no training in tattooing or piercing, and they don't know what they're looking for, so that needs to be addressed.
As in difficulties for the local governments, I don't think it should make a difference really. Our council at the moment are quite strict on rules, bylaws and everything else, licensing and things like that. They are quite strict anyway, which is a good thing.
If somebody is a member of a professional body, then it should be that professional body that has the responsibility rather than the local council.
Well, I think that the local authority has its part, but the best place should be the police. They're breaking the law. If somebody's tattooing underage, it's grievous bodily harm. It's a permanent mark that is left. That's GBH. That's it. It's assault on a minor if they're under 18. It's administering a noxious substance. It's they are more. The law already is there that they can say, bam, we can enforce this. So I don't think it's in the council's position to do it.
Byddwn ni'n gobeithio fydde fo yn diogelu iechyd y cyhoedd. Dwi'n siŵr am wella iechyd y cyhoedd. Ond yr prif nod fan hyn ydy wneud yn siŵr fod pawb sy'n ymarfer y math yma o driniaeth arbennig neu special procedures fan nhw'n gael nhw'n Saesneg sydd yn tyllu'r corff. A hwnna di'r peth penodol da ni sôn amdano fan hyn ynddo. A mae'n bwysig iawn, mae'n amlwg bod unrhyw fath o broses sydd yn tyllu'r corff yn cael ei gynnal yn ddiogel ac yn effeithiol.